Hi, this is Jay McCallum at Core Balance Therapy, and I want to talk briefly today about sort of a stuck neck, and this classic pattern that we see occasionally of people waking up most commonly with sort of a one-sided, really sharp mid-neck pain. Sometimes it can be so painful that people will sort of hold their heads off to the side to get pressure off of it. Classically, it's really painful to turn towards the painful side or tip towards the painful side, and a bit relieving to move away. I'm not talking about something down the arm here. I'm talking about acute mid-neck pain that came on often in the morning without any big trauma. That's a condition that's not really all that well understood, but we don't think it's a serious condition in the vast majority of circumstances. If there's not been a trauma or something like that, we think that this is a case of a really overreactive, overprotective nervous system that is kind of overreacting to a relatively small thing because the neck is such a vital structure. So, things that you can do. The first thing is, don't stress about it. Don't worry about it. Don't run off to go get X-rayed or MRI'd or something like that, because the odds that there's anything really structurally wrong with something is really minimal. Gentle movement. And so I usually tell folks the first thing that you want to do is, just as you're laying in bed, just roll it back and forth. Bump that movement, bump it, just kind of get it loosened up. And don't try to force the movement, but just move within the range that you can move. I have had good success in using a self-mobilization, using a towel. The idea here is to sort of support the joint and help it move. So if I have pain on the right side of my neck and I can't turn my head to the right, I'll use a towel. I'll catch the towel right about where the pain is. I'll cross my arms, and that's the thing people tend to forget. Cross my arms so that my top arm is the painful side, and I'm going to support my neck with the bottom arm. I'm going to support up across my face, not my jaw, but my face, and turn. And the goal of the towel is to allow the motion with less pain. So we want to see significantly less pain with the movement. It's not a stretch. It's not intended to allow you to put more force into the movement, but to support the movement. And you do 10 to 12 turns, rest, move around, come back and do another 10 to 12. Repeat that several times, 2 to 3 times, usually every few hours, to try to coax that joint into moving a little bit better. And really expect this to clear off in a matter of a few days. And so if it's sticking around and it's not getting better and you want somebody to have a look at it, then please give us a call. As always, post any questions you have in the comments, and we'll look forward to talking to you again next week. Thank you.